Today, we're diving into a sector that's not just growing, but uh, absolutely surging, Australia's pharmacy industry.
It really is booming.
Yeah, I mean, just to give you a sense of scale, it's projected to grow by a pretty significant 14.7% over the next 5 years.
Wow.
And right now, there are over 2,400 full-time pharmacist positions open. It's a field experiencing a real boom. And as we'll discover today, it's far more diverse than many might imagine.
That's the surprising part for a lot of people, I think.
Definitely. We've been poring over a comprehensive guide to Australian pharmacy careers, and our mission today is really to unpack the huge range of opportunities here.
Hmm.
We're talking like more than 25 distinct roles.
Yeah, over 25. It's quite something.
From the core work of dispensing medication to highly specialized clinical services and even sophisticated business and retail management within pharmacies.
Right.
So we'll explore what these roles actually involve, general salary expectations, and the clear pathways to get in, whether you're a student, an intern, or maybe an overseas pharmacist looking to move to Australia.
Yeah, covering all the angles.
Exactly. Get ready to maybe rethink what a career in pharmacy truly looks like. Okay, let's unpack this then. When most of us think pharmacist, we picture someone behind a counter.
That's the classic image, yeah.
And that image is certainly part of it, but this guide really makes it clear that the scope goes so much further, right?
Absolutely. What's truly fascinating here is just the sheer breadth of the profession now. It's moved, well beyond just traditional healthcare dispensing.
So what areas does it cover now?
Well, the sector spans that core dispensary work, sure, but also highly specialized clinical areas and even significant business and retail operations. This kind of expansive nature offers genuinely diverse avenues for professionals looking for a rewarding career. And it's all underpinned by, strong job security, competitive salaries, and plenty of opportunities for professional growth.
Okay, so if we start at the foundation, the bit people recognize most, the dispensary,
Hmm.
how does a career typically progress within that sort of traditional pharmacy setting, say, right from the student level?
Absolutely. The guide lays out a very clear career ladder there. It often kicks off with the pharmacy student.
Right.
So you're immersed in coursework, obviously, and getting crucial clinical placements. For entry to uni programs, you typically need an ATAR of 80 or higher.
Okay, standard uni entry.
Yeah, and prerequisites in chemistry, maths, and English are usually required. As a student, you earn a graduated salary. It starts around AU $25,000 in your first year,
Okay.
and that increases to about AU $27,500 by your fourth year. It's really about building that foundational knowledge and getting that vital initial hands-on experience.
So a clear path there. What comes after graduation, that crucial next step?
That crucial transition is to an intern pharmacist. This is a supervised 12-month structured training program.
Ah, the internship year.
Exactly,
Right.
where you apply your theoretical knowledge, you're involved in patient consultations, getting that practical experience, and importantly, rigorously preparing for your registration exams.
And the pay during that.
Interns typically earn between, say, AU $62,000 and AU $71,000 annually.
Okay.
The pathway itself involves graduating from an accredited program, getting provisional AHPRA registration,
Right.
the Australian Health Practitioner Regulation Agency. That lets you practice under supervision,
Got it.
and then securing an approved intern position.
And supporting the registered pharmacists, we often see dispensary technicians. They seem vital for the daily flow, don't they?
Oh, they absolutely are. Dispensary technicians are instrumental in the workflow. They assist pharmacists with prescription prep, manage inventory, handle insurance claims, do essential admin tasks.
Lots of key support roles.
Definitely. Their salary generally ranges from around AU $43,500 up to AU $70,000.
And how do you become one?
To step into this role, you typically complete a certificate 3 or 4 in community pharmacy and then get quite a bit of on-the-job training.
Right. Then, at the very heart of the dispensing operation, you have the dispensary pharmacist.
Yes, this is the core role, you could say. A dispensary pharmacist is responsible for accurately dispensing meds, providing vital patient counseling, doing drug utilization reviews.
What's that exactly?
That's where they assess a patient's entire medication profile, to ensure safety and effectiveness, making sure everything works together properly,
Oh, okay. Makes sense.
and just maintaining overall medication safety standards. This role commands a strong salary, typically between AU $110,000 and AU $123,000.
And the pathway to get there.
Pretty clear. an accredited pharmacy degree, successfully completing your intern program, getting that full HPRA registration, and passing the pharmacy board exams.
And then overseeing this whole operation is the dispensary manager. They're really running the show, aren't they?
That's right. The dispensary manager supervises daily operations, manages the staff, ensures regulatory compliance, handles inventory, deals with customer escalations. The works.
A big job.
It is. They earn between AU $121,500 and AU $127,500 annually, roughly.
And what do you need for that? Just experience.
Well, it requires a pharmacy degree, HPRA registration,
Right.
usually 3 to 5 years of experience, plus strong management and leadership skills. Sometimes specific management training, too.
So you can really see a clear, structured progression here. You're building up skills and responsibility, from student all the way to management within that dispensary setting.
Very much a defined career ladder.
But here's where, for me, it gets really interesting, and arguably where the profession is truly transforming. Pharmacists aren't just in the dispensary anymore. They're becoming highly specialized healthcare providers, kind of moving to the forefront of patient care.
Absolutely. The profession has evolved significantly.
Yeah.
I think it's partly driven by a need to ease the burden on other parts of the healthcare system, GPs, hospitals.
And using the pharmacist's accessibility.
Exactly. Leveraging their accessibility. Take the professional care pharmacists, for example.
Okay.
They provide specialized clinical services, things like comprehensive medication reviews, managing chronic disease programs, offering vaccination services, often collaborating closely with multidisciplinary teams, doctors, nurses, etc.
So much more clinical. What's the salary range there?
It can range quite widely, actually,
Yeah.
from about AU $70,000 up to AU $130,000, depending on their level of specialization and experience.
Right.
And this isn't just about adding services. It's really about pharmacists stepping into the gap, becoming primary points of care for chronic conditions and preventative health.
That's a huge shift from just dispensing pills.
It is.
And there are even more niche roles, like those in drug and alcohol administration. This seems like very specialized critical work.
It is indeed. In Drug and Alcohol Administration, or DAA, pharmacists play a vital public health role. A DAA manager, for instance, oversees critical methadone and buprenorphine programs.
The opioid replacement programs.
Correct. Ensuring compliance, staff training, all that. Salaries there are between roughly AU $141,000 and AU $145,500. Then the DAA pharmacist is the one directly dispensing the opioid replacement therapy, doing patient assessments, providing essential counseling.
Okay.
They typically earn between AU $110,000 and AU $123,000. And these roles require very specific additional training in addiction medicine. You can't just walk into it.
No, it makes sense. It sounds like pharmacists are taking on a much more active clinical role in patient management generally. What about in aged care? Medication management there can be incredibly complex.
You're right. And aged care pharmacists or managers are crucial in this area. They manage medication systems within aged care facilities, ensure regulatory compliance, coordinate with other healthcare providers, really trying to optimize resident care.
And the salary for that.
Typically between AU $67,000 and a $97,000.
Yeah.
Similarly, vaccinating pharmacists are now a really common sight.
Yeah, you see them everywhere.
They administer vaccines, participate in broader public health initiatives, earning in the range of AU $110,000 to AU $123,000, often supplemented by vaccination fees per shot.
Right. And beyond vaccinations, what about other health education roles popping up in pharmacies?
Well, the diabetes educator or manager is another specialized role reflecting this expanded clinical scope.
Okay.
They provide essential diabetes education, help manage insulin therapy programs, offer comprehensive lifestyle counseling, really important work.
And the pay.
Similar range to aged care, actually, around AU $67,000 to AU $97,000. Then you have compounding pharmacists. These are the ones who prepare customized medications for individual patient needs.
Like making specific creams or mixtures?
Exactly. Often in sterile environments, ensuring absolute quality control. It's highly specialized work, often yielding an hourly rate around AU $50 or so.
And something truly unique that the guide points out, found in some Australian pharmacies, is the naturopath.
Yeah.
This isn't a role you typically associate with a pharmacy at all.
No, it's quite distinctive and a clear indicator of the broader strategic shift we're seeing. Naturopaths provide natural health consultations, recommend herbal medicines, integrate complementary therapies.
Interesting. What's the salary like for them?
It ranges widely from AU $65,000 up to AU $130,500. This role, of course, requires a specific degree, a Bachelor of Health Science, in naturopathy.
Right, not a pharmacy degree.
Correct. And if we connect this to the bigger picture, I mean, the inclusion of naturopaths suggests a strategic pivot. Pharmacies are becoming, or aiming to become, holistic wellness hubs.
Responding to consumer demand.
Exactly. Responding directly to consumer demand for integrated natural health solutions. This really challenges the traditional perception of a pharmacy, doesn't it?
It really does. Opens up intriguing possibilities for a more comprehensive approach to community health. So that raises a really interesting question. What does this all mean for someone who's maybe more interested in the business or retail side of healthcare? Pharmacies, at their heart, are also businesses, right?
That's a great point. And the guide highlights several key business and retail roles. A pharmacy business or operations manager, for example.
Okay, sounds senior.
It is. Holds significant strategic oversight, managing financials, overseeing multiple locations potentially, analyzing performance, driving business growth.
And the salary reflects that.
Yeah, typically between AU $118,500 and AU $169,500. An MPA is often preferred for this kind of senior leadership position.
Makes sense. And on the ground, in the retail space itself, managing the everyday customer experience.
There you have the retail manager, supervising the in-store operations, managing staff schedules, optimizing customer service, implementing marketing strategies, all focused on profitability.
Salary range.
Typically from AU $105,000 up to AU $169,500. Similar top end to the ops manager, but maybe a lower starting point. And supporting them, absolutely crucial, is the stock controller.
Right, managing all the products.
It's exactly. Inventory levels, ordering systems, stock audits, storage protocols, expiration dates, the whole supply chain. Their salaries can range quite a bit from AU $35,000 maybe up to AU $114,000 depending on the scale of the operation.
These roles are clearly vital for the commercial success, keeping everything running smoothly. What about the frontline staff who aren't pharmacists, but are essential to that customer experience?
Good point. The pharmacy assistant is often the first point of contact.
The face of the pharmacy, often.
Pretty much. Providing frontline customer support, handling product sales, assisting with various admin tasks. Their salary generally ranges from about AU $43,000 to AU $68,500. And then there's the pharmacy administrator, more back office focus.
What do they handle?
Critical functions like patient records, insurance claims, managing appointments, ensuring all the compliance documentation is in order. They typically earn between AU $32,500 and AU $100,000.
It's clear that pharmacies are more than just dispensaries. They're really comprehensive retail establishments now. And the guide even mentions roles that don't require a pharmacy degree at all, like in the beauty sector within some pharmacies. That was surprising.
Precisely. And it underscores this evolution into a comprehensive community hub. You've got the retail beauty advisor
What exactly?
providing skincare consultations, recommending cosmetic products, doing demonstrations, earning between, say, AU $57,000 and AU $65,000. And for more hands-on roles, there's the retail beauty technician.
Like performing treatments.
Yeah, performing treatments, operating specialized equipment, maintaining the treatment rooms. Salaries there are from about AU $53,500 to AU $72,000.
And again, these don't need a pharmacy degree.
Nope, but they do need specific beauty therapy certifications. It just highlights how pharmacies are integrating health, wellness, and even beauty services now. Requires a really diverse skill set across the whole business.
Definitely meeting varied consumer demands. So with all these incredible opportunities laid out, what are the actual pathways? How do you get started in a pharmacy career in Australia? For pharmacy students, what's that initial journey?
Okay, for aspiring pharmacy students, the education pathway typically involves completing a 4-year Bachelor of Pharmacy, usually with honors,
Right.
or there's a 2-year Master of Pharmacy for graduate entry, if you already have a relevant undergrad degree.
And accreditation is key, I imagine.
Crucially, these programs must be accredited by the Australian Pharmacy Council, and they have to include a minimum of 350 hours of supervised clinical practice.
Okay. And the prerequisites we mentioned earlier.
Yeah, key uni prerequisites generally include an ATAR of 80 or higher, with strong performance in chemistry, maths, and English.
Okay. And for those finishing up their degree heading into that internship year, what's the registration process like then?
Right, so intern pharmacists need to graduate from their accredited program first. Then they apply for provisional registration with AHPRA, the Health Practitioner Agency.
The provisional step.
Yes. Then they have to complete that 12-month structured internship under approved supervision, and finally pass a series of competency-based registration exams.
Sounds pretty rigorous.
It is, but it's absolutely essential to become a fully registered pharmacist.
Okay. What about those coming from outside Australia? The guide mentioned a record increase in overseas pharmacist applications, which really speaks to the demand. What's that process look like?
Yeah, that's a significant and definitely viable pathway, given the strong demand. For overseas pharmacists, the migration process involves several key steps.
Like what?
First, a skills assessment by the Australian Pharmacy Council. They check if your qualifications match up.
Okay.
Then, passing the OPERA exam, that's the Overseas Pharmacist Readiness Assessment. It's actually a new exam, replacing the old CAP-ES exam from March 2025.
Good to know. Anything else?
You also need to demonstrate English proficiency, usually through recognized exams like IELTS, PTE, or OET, standard migration requirement.
Right.
After successfully navigating those steps, it involves completing an Australian internship training program, similar to local grads, and finally, getting that full AHPA registration. The robust demand makes this a really attractive option for qualified professionals from abroad, I think.
Definitely sounds like it. So it's clear the initial pathways are well defined. But does the learning just stop once you're registered?
Right.
Or is continuous growth kind of baked into the profession?
Oh, not at all. In fact, continuous growth is fundamental.
Mm.
All registered pharmacists are required to maintain ongoing professional development, CPD,
CBD, yeah.
including mandatory training to stay current with pharmaceutical regulations,
Mm.
new drugs, best practices, all of it.
And beyond the mandatory stuff.
Well, beyond that, there are extensive specialization opportunities. You can pursue advanced certifications in areas like clinical pharmacy, immunization, diabetes management, aged care, compounding,
Lots of options.
loads. These provide clear pathways for career advancement and significantly, usually higher earning potential. The field truly encourages and rewards lifelong learning.
We certainly covered a lot today. It's truly clear that Australia's pharmacy industry offers just incredibly diverse, rewarding career paths. Competitive salaries, strong job security, it seems, and significant opportunities for professional growth across so many different healthcare settings. It's truly a field with many, many doors.
Indeed it is. And, consider how this expansion of pharma roles, from that specialized clinical care we talked about to strategic business management and even integrated beauty services, how it reflects a broader, maybe fundamental shift in how we access healthcare and community services.
That's a great point.
What implications does this increasingly integrated model have for the future of health and wellness? And what new types of roles might we even see emerge next as pharmacies continue to evolve? It's constantly changing.
Fascinating stuff to ponder. We've covered a huge amount today. What stands out to you listening in about these opportunities? What new questions has this deep dive sparked for your own learning?